In the past 3 years, more than 150 San Diego doctors have been disciplined for everything ranging from negligence to sexual abuse.
Team 10 investigative reporter Jennifer Kastner has spent months looking into the state board that investigates bad doctors, which critics argue has serious flaws.
I think we've had a number of them, which is alarming. It's like, oh, San Diego again.
San Diego again, says patient safety advocate Marian Hollingsworth. She's talking about the sizable number of local doctors who've recently made the news for serious matters. Take Oceanside doctor Edgar Manzanera. He was arrested this summer, accused of sexually assaulting patients with the VA. A few months ago, San Diego doctor Mark Zwyfak got his license back after he'd had it taken away for watching child pornography on his computer at the Kaiser Permanente Medical Center in El Cajon.
I didn't collect it, I didn't produce it, I didn't distribute it, but I viewed it.
This April, San Diego anesthesiologist Bradley Hayes' license was surrendered following the disturbing allegation that he passed out in a hospital bathroom after injecting himself with an opioid medication.
The anesthesiologist, instead of administering the medicine to the patient, administered it to himself to get high.
Also in April, San Diego's Dr. Brett Gerber was issued a citation related to his arrest for apparently having ecstasy, psychedelic mushrooms, and cocaine. He agreed to a diversion program with the Medical Board of California.
The board's mission is consumer protection, and it takes that mission very seriously.
Carlos Villatoro is the spokesperson for the board, which oversees doctor licensing. 10 News wanted to know if San Diego has more disciplined doctors than other parts of the state. So in July, we asked the board for information like the number of gross negligence, unprofessional conduct, and sexual misconduct cases in our area compared to other areas. The board replied with this: it would cost 10 News $6,590 to fulfill our request. So we turned to 4patientsafety.org, a watchdog site that Hollingsworth helped start with advocate Eric Andrist after struggling to get information from the board.
This was the flag that was draped on his casket.
Following her own father's medical treatment, where he was given a cocktail of psychotropic prescriptions.
He was drugged out of his mind, and which led to his death.
4Patient Safety draws its information from the medical board, court records, and news reports. According to the site, since 2015, disciplinary action has been taken against 156 San Diego doctors, 76 for unprofessional conduct, 81 for gross negligence, and 22 for sexual misconduct. She says she hopes this site gives people the user-friendly tools that the board's website lacks.
You have to click on the different links, you have to scroll through sometimes 30, 40, 50 pages of documents to find the accusation. That's complicated for some people.
We want people to read the documents. The medical board wants people to be informed.
In defense, the board argues that patients can sign up for license alerts and follow disciplinary actions through the phone app and social media platforms.
I had 4 kids. I was not going to be looking up the doctor every single time we went in for bronchitis or a sprained ankle or an ear infection, but that's what they want you to do.
Advocates are also critical of some board investigations that seem to drag on. In 2017, San Marcos Dr. Manuel Tanguma surrendered his license after several patients accused him of groping and other sex acts in the exam room. Almost 2 years passed between the board's first accusation and his license being put on interim suspension. This May, our cameras captured former San Diego psychiatrist Leon Fairman, 75, leaving jail with a towel over him to hide his face. He's since pleaded guilty to a felony charge of having sexual contact with 7 patients. In his case, 9 months passed between the board's accusation and his license getting surrendered.
There have been physicians who can continue practicing for years while they're being investigated, but they're not required to notify their patients. Is that correct?
If the accusation has not been adjudicated, there is no legal requirement. When a physician receives an accusation, it doesn't mean that they're automatically guilty.
Doctors deserve due process, explains Villatoro, who adds that investigations must be thorough, which takes time.
Why is a police officer put on paid leave and not a doctor?
Because doctors are on this pedestal. And the medical board and society in general goes, oh, it's a doctor.
And the vast majority of doctors do deserve respect for their work, she says, just as long as patients are always put first.
We're not anti-doctor. We're pro-patient, anti-bad doctor. And we want as many good doctors as we can get.
Now, during our sit-down interview with the medical board, they surprised us by offering to give us access to their doctor database so we wouldn't have to pay the thousands of dollars they initially quoted us 3 months earlier.
We just got that database last week. We are still working through the numbers. And starting the first of the year, a new law goes into effect requiring doctors to tell their patients if they've ever been put on probation for serious misconduct involving patient harm.